Hello and welcome to the Quincy Access Television studios. I'm Mark Crosby. Thank you for joining me for your police department. Just a closer look at your police department. That's what this show is all about. Today we have two guests joining us. We have Tim O'Brien and Samantha Curley. They are licensed mental health counselors for the Quincy Police Department. I want to welcome you into QATV. First time for the two of you. So again, welcome.
Thank you.
Thanks, Mark, for having us.
Pleasure. A lot to cover today. I guess I'd start, and either of you can kind of join in, the role of a mental health counselor in a police department. I guess the role and the importance of that position. Maybe Samantha, we'll start with you.
Yeah, so I've been with the Quincy Police since, I think I started in May. It's been about 7 or 8 months. Tim has been a wonderful mentor. He's been here for about 7 or 8 years. He could probably supplement a lot of this. We primarily respond to live calls alongside police officers. So the calls would be mental health crises. The police officers would determine that there is a mental health need for either Tim or myself. We would conduct a psychological evaluation on scene alongside the officers. We would determine if the individual required medical attention, if we needed to fill out what's called a Section 12A to involuntarily transport them to the hospital. We can offer resources if they don't meet the criteria. So to meet the criteria, they need to be at risk of harm to themselves or others, or just generally unable to care for themselves. Sometimes someone could be having a mental health episode that is severe, but not necessarily rising to the level of an involuntary transport. So Tim and I would then step in and provide resources to connect them to maybe like a therapist, case management, kind of whatever their needs are. Every situation really is different. Other than live calls, we also provide follow-up services. What do we do for that? Kind of similar, I guess, kind of supplementing with resources that they might need if perhaps we're not on that day. If patrol determines that it would be in the individual's best interest to meet with a clinician, like a licensed clinician, then we can kind of go and lay eyes on them and see how we can best help and provide resources to the community.
So Tim, I guess since you've had more years in this position, talk about that, maybe talk about how you got on board first, I guess, and then we'll look into maybe over those 8 years, how the roles have changed or evolved.
Yeah, I got into this, I had previously worked at Bridgewater State Hospital and Old Colony Correctional Facility, and I got recruited by a company called Aspire Health Alliance, who is the local emergency service program, in order to kind of be what the title is, jail diversion clinician. And it was paid through a grant to reduce unnecessary arrests for people that have mental health issues and unnecessary hospitalizations. Because sometimes people need a different level of care than just going to the hospital and getting checked out at the ER. They might need what we call like a partial hospitalization, which it's a little bit less intrusive to their life, or other levels of care like intensive outpatient. So we try to gear our resources towards the individual and the specifics of the problem. And like Sam said, every situation's very different. There are some situations where we have to provide a little bit more like psychoeducation to the family in regards to the resources around, or in regards to the course of illness, depending on whatever they're suffering from. And you know, each situation is different, and we just try to tailor it to the individual as best we can. And we've been incredibly supported by the Quincy Police Department. They were the second in the entire state to get a clinician. I was not the first. There was a woman that did a great job for 10 years before me, and kind of set the path. But being kind of the second city in the entire state to do this, they're kind of trailblazers in terms of how police interact with individuals that are suffering crisis. And we really pride ourselves on de-escalation and resolving incidents without any force, and I think we do a great job of that.
So second in the state, so quite progressive. What about the country? What do these positions look like throughout the country?
Yeah, so I think Massachusetts, in terms of police training, is at the cutting edge. We're at the highest. And then I believe Quincy actually it trains more than any other city in Massachusetts. Other states have implemented it. From my kind of anecdotal, just surveying what they're doing, they have a little bit of different model, whereas they're not as embedded oftentimes in other countries, whereas Sam and I are in depth in the police department, have our office there, and aren't going anywhere else. So it's not like we have like a separate office. We're hard to reach. And things like when an officer has a casual question that doesn't rise to like a formal process where they would ask about mental health or about how to handle something, things like that can be very, very helpful.
And I would also add to Tim's point, something that Quincy does that not every town or state does is we ride along with the officers. So if there is a call, we're always arriving with officers on scene, and there's usually an officer or two already there. So Quincy does an excellent job of prioritizing our safety since we're civilians and not sworn officers.
Which brings me to, I guess, the next question. How many counselors, clinicians are there?
For Quincy,
For
there's
Quincy.
just the two of us.
Oh, okay. And you're able to, I guess the calls aren't extreme so that you're able to ride along, I suppose, as far as the numbers.
Right, that's
extreme was the wrong
Yeah.
word.
It's a great question. Actually, this past year we had over 1,000 calls for service, which I believe was almost double from the year before, if I'm not mistaken, which I think kind of influenced the reason to hire a second, because for so long Tim handled basically the entire city on his own and does an excellent job. So for the most part, we are able to respond to all the calls. I think there's been a couple times where we've both been at a call and maybe there's a third or fourth call that's come in that we haven't necessarily been able to respond to. We also have several officers that have mental health training that can kind of supplement. They're not licensed clinicians, of course, but they have the background to help de-escalate the situation and kind of direct them to us so we can provide more appropriate services.
So I guess talk a little bit about the training involved to be able to handle a situation and, as you had both mentioned, de-escalate the situation.
I think one of the main bases of training for officers is CIT training. And that's a 40-week class that is done locally usually, and it's led by mental health professionals. And the design is to give some education about mental health, but also some like practical tips on how to deal with people with mental health issues, and the other part, like having some empathy for them so that you can relate. Because we've found across studies in all of psychology, the biggest factor related to a good outcome is the rapport, and officers do a great job of developing that short-term rapport with people in order to prevent violence or the situation becoming dangerous to people nearby. And a lot of that is done through training, through whether it's mental health first aid or CIT, but also just experience. These officers have so much experience just going from call to call because mental health is such a big issue in the city and in the country as a whole. So they have a lot of experience, and when you have experience, you see outcomes, and you see what went well, what didn't go well, and I think that really, really is very vital to why they do such a good job. And I also think the leadership, it trickles down. So the people that are in positions of power there, they emphasize de-escalation, they emphasize verbal judo, as they often call it, and what you emphasize will be emphasized. So I think they do a great job because of that.
I think it brings up community policing. It just brings that to mind because folks should be comfortable with, I guess, what used to be considered the beat officer, the officer on the beat. And if that officer is involved in that community and they're approachable, right there you're avoiding a potential dangerous situation, correct?
Absolutely. Yeah, Quincy has a really proactive approach in the community where they're making themselves known, available. They'll drop in and check on people, see how they're doing, community centers, residences, schools. So just to your point, Mark, I think they do an excellent job of kind of mitigating some of the potential calls that we could be getting if we didn't have such a great community service unit.
And something you had mentioned, Tim, that the amount of folks that need mental health assistance. Seems like those numbers are increasing, but is it really that it was never really understood years ago?
Yeah, I think with the stigma related to mental health, a lot of people either were embarrassed or were concerned about how it would make them look, so they didn't necessarily come forward. And the other piece is that we've gotten a lot better as a society, and especially as like mental health professionals, at identifying mental health issues and taking the necessary interventions to prevent them from getting too bad or getting too worse. So I think as a country, we've certainly done a lot better job, and we've had a lot more proactive kind of interventions. And because there's so much less of a stigma, people recognize it earlier, and the earlier you get into treatment, the better the outcomes are.
And I guess I'm just thinking the inclusiveness and the potential language barriers. How do you overcome, I guess, language barriers? In such a diverse city, Quincy is quite diverse.
It can be tough. We are fortunate to have several officers that are multilingual, some bilingual, some beyond that, which is a huge asset. So if they're on shift and can physically come to the scene to help translate, we also have access to a translation line, so that would be over the phone. That can be a little bit tricky, especially for the calls that we usually respond to. Some of the folks we deal with could be in a psychotic episode, so they could be experiencing hallucinations and delusions and just things that are not based in reality that you and I might not be able to see. So utilizing a translation line in situations like that is not a perfect system, but we're grateful to have it as an option. It is something that Tim and I have been talking about to kind of see, like, what can we do to maybe problem solve this or make it a little bit easier for ourselves, but also for the department at large.
And I guess my next question would be, how do the two of you work with other city departments? And I guess what I'm getting at is, let's say the Quincy Health Department. Let's say there's a hoarding incident. Talk about that and your role in that kind of a situation.
I'm actually a part of the hoarding task force
Well, there you go.
within the city.
Okay.
So a lot of times we'll connect with different people that are, for different reasons, being asked to do an inspection, and along the way they might see that there's some severe mental health issues, or like you said, a more hoarding situation where there's safety risks involved, because hoarding can be a very, very difficult disorder to deal with, as it's one of the few illnesses that each decade it gets progressively worse. And oftentimes, if people are starting to exhibit hoarding behaviors in their 30s or 40s, by the time they're in their 70s, oftentimes it can be a safety risk of them just living in their own apartment. So it's a very, very difficult disease to try to treat, because oftentimes there isn't medication that you can prescribe that will directly treat the issue, and a lot of times people that are engaging in hoarding behavior might not meet the criteria for like an involuntary hospitalization. Sure. So without that, it's forced up to them to what they're voluntarily able to seek out for treatment, and oftentimes that can be a barrier as well.
Anything to add to that?
Just to kind of piggyback off what Tim said, it can be so difficult, because even if there's a hoarding situation and we have resources to come in and clean everything out, declutter, and set them up with a really nice living space, unfortunately with this kind of diagnosis, the issue isn't really the cluttering and the holding on to items. That's a symptom of a deeper issue. So oftentimes it will kind of return back to where it started from. And like Tim said, in our role, we are able to transport someone to the hospital if they're meeting the criteria of not being able to take care of themselves or an imminent risk for their safety. But even with severe hoarding situations, it's really difficult to meet that criteria. It has been done, but sometimes they kind of fall through the cracks there, so it can be challenging.
Without highlighting specifics, could you give me a couple of examples of what your day might involve?
Yeah, so usually we start the day by reviewing all the reports since the last time we were in. So typically, I'll be reviewing the reports from yesterday and last night because I would have been out on the road, and then last night I wasn't working. After that, we would then have a meeting with our lieutenant, who would assign cases to be followed up on. And we try to triage cases based on acuity, and that's something that Sam and I take pretty seriously, where we kind of get together and look at the symptoms and look at the situation and the past history, and then determine the risk involved. And we try to, seek out the riskiest cases first in that order. And what we do is we'd have plainclothes officers in an unmarked vehicle that are, like we said, specially trained in CIT and mental health first aid, and that have been working with us for a while. They would bring us to the call. We would try to, do a psychiatric assessment or offer resources depending on what the situation is, and then kind of make a determination from there. And then sometimes we'd follow up several more times. Other times we may be stretched so thin we're unable to. And then along the way to while we're doing these follow-ups, we have our radios on, and if someone were to call for my code name CR1, hers is CR2, if they were to call for either of us, that would take priority because it's an active call that is a lot more dangerous because it's still going on, or they have a lot more, it's a lot more important for us to intervene and offer either resources or de-escalate or do a psychiatric assessment. So we'd then go there and make the assessment, and if the individual was, say, transported to the hospital on a section, we would then follow up with the receiving hospital and also the local emergency team that would be doing the emergency evaluation.
I'm supposing that you really have to have a good take on the person, and I'm thinking age that you're dealing with. If you're dealing with a teenager, it's probably a lot different than dealing with an adult. Am I correct? In
Yes.
any situation.
Yes.
Right, age is definitely something we take into consideration.
Yeah, even people that are suffering from the same diagnosis, for example, are going to be drastically different because one diagnosis might manifest this way, the other one might manifest that way. One might have other additional stressors, whereas the other one may have less, but they're in a different way. Some people may have like housing issues, or some people may have like lack of insight, meaning they don't understand their diagnosis or need for treatment. So every single case is so drastically different. And the other thing is that because things are happening in real time, oftentimes the information is a little bit different when you get there. So people are calling in 911 and they're reporting on what they see, and that what they see is the truth at that point, but oftentimes when you get there it's a little bit different. So Sam and I have to be very like psychologically flexible and open and ready to kind of roll with whatever the scene is, and maybe a lot different than what we originally thought.
And Samantha, you had mentioned kind of the follow-up. What's involved there? I suppose it depends again on the case.
It does, yeah. So sometimes we're following up on someone that we have previously sectioned to the hospital, so we're a little bit more familiar with them. Just kind of making sure they have the supports they need, they're responding to their medications appropriately, whatever it may be. Sometimes we're following up on cases that officers have kind of referred to us, so maybe we've never met these people. It could be a call where an officer was maybe unsure if there was some substance use involved or a mental health component, and then Tim and I would go and follow up and conduct an evaluation and see what that person needs. Sometimes they may not need our services, and sometimes we may have been able to kind of head off a potential crisis that could have happened if we didn't intervene at the time that we do.
So I guess what I'm trying to gather is since there's two of you and many calls come into the police department, when is it determined if you would go along on that particular ride? Is it if it's a domestic violence call? I mean, what
Because
are the
there's so
calls?
few
Good
of us, much like how we have to triage our follow-ups, our communications does a great job of triaging the calls. So everything's going to come in, and like a local agency may want us to attend a call, and we would be happy to do it. However, if there was another call that was a little bit more risky or needed a little bit more of a, let's just say, a mental health type approach versus a police approach, our communications division would then decide which one was most important. And the benefit to having two of us is if there are two calls at once, Sam or I could break off and go to the other call and then kind of circle back and figure it out.
Right, and consult together.
Yeah.
Some of these cases are really complex, and it's nice to be able to bounce ideas off with another clinician.
And I have to say that has been one of the biggest game changers since having Sam, was just having another very, very good clinician to be able to bounce ideas off of and kind of test out what I thought, my theory of what's going on with a certain case, and having just that third unemotional party involved that is a trained licensed clinician. It's been very, very instrumental to me, and I think it really has helped the city of Quincy a lot.
Well, what I'm thinking of too is that people involved in a situation would potentially respond differently to a police officer than to a civilian, right? So their attitude, their response could be a lot different. So having you two there, I think automatically brings down the level, the intensity. Because some people, some folks' relationship with police officers might not be the best.
Right, and that's why the officers with us, the ones that are trained in mental health, will actually wear plain clothing for that reason.
Already bringing down the temperature. Yeah, I think you had mentioned that in the past.
Yeah.
Talk about continuing education in this field.
Yeah.
And just a thought, so many people are on the internet, social media, obviously a component that has to be kind of brought into any situation now.
Yeah, we definitely try to target things that are specific to our job. And I think the thing that with Sam and I in this role is that we are psychology nerds. Like, we love psychology. When we're in our free time, we're discussing things related to psychology and related to being a counselor. So this is something that we kind of live and breathe. And it's very, it can be a stressful job, I'll say. But because there is that interest and there is that passion, I think it mitigates a lot of the burnout for myself, and I think
It's like a hobby too.
Yeah.
Well, and that brings me to maybe networking, right? Folks in your field, do you have the opportunity to network with folks that do the same thing that you do?
We do, yeah. So we are in pretty consistent communication with neighboring towns like Braintree, Weymouth, Randolph. Sometimes we have folks that will maybe live in one city, live in Quincy, say, and work in Weymouth. So it is nice to have the relationships, the working relationships we do with the other embedded clinicians nearby. I think it just kind of enhances all of our communities.
And obviously this program will educate some folks about the role that you both play and the positions within the Quincy Police Department. What other outreach would you potentially do? Is there any involvement, let's say, with the school department?
Yeah, so that's actually a great question, Mark. So we're kind of used as a jack of all trades clinician. So if, say, there was for example, like a tragedy in the city, they may send Sam or myself out there to help group processing with the people involved. Or if there was, say, like someone that had committed suicide, or something that has a potential ripple effect psychiatrically to those nearby, we may just for that day go and offer resources or tailor our whole day around that situation. And that's the good thing about this job, is that we can do so many different things and we can kind of help people in so many different ways. But it certainly is something where you don't know what's going to happen when your day starts, because we're working with emergency services. So if there was anything that was really kind of intense that happened in the city, there's a good chance we're going to be involved in it. And I think a lot of other clinical roles, you have a little bit more of a understanding of where your day is going to take you, whereas this one you kind of have to be ready to go do something that you haven't thought about in a while, maybe.
Well, and this is what you just said. What it brings up in my head is no one was expecting COVID. So with that, a lot of folks were trying to process it, including myself, and having difficulty, some more than others.
Yeah, certainly. Yeah, COVID, what it really did too was it took away a lot of the resources for people that were maybe not struggling the worst, maybe the people that were kind of in that middle range of struggle. And it took away their resources, so oftentimes they would decompensate a little bit worse. And the people that are already maybe struggling the most, it definitely impacted their life and impacted how they were able to necessarily cope with whatever their issues were. But I think really people that were kind of in the middle there really struggled because they had a little bit more structure and routine, and taking that away, some are still trying to struggle to get back to where they were.
Sure. We have just a couple minutes left. Anything that you would like to add that maybe we haven't touched upon?
I think that I just was really impressed when I first started here working with the Quincy Police, just their ability to de-escalate people and to remain calm, and kind of just their overall philosophy with like how they're going to help the citizens of Quincy. And when I first started, I wasn't sure if it would be consistent with my own, and it's just been really refreshing to see the professionalism day in and day out, and to see these just really amazing things that they do, because I do think they have one of the hardest jobs in the world, and I really do think that Quincy does the best job in the state. And
because you're basically meeting people at their worst, right?
Right.
Or could potentially be meeting people at their worst.
Yeah, and you're meeting them in the environment where they are their worst. So there's so many moving pieces. So it's a lot harder for an individual to be compassionate and empathetic when they're also worried about their own safety. And that's something that they do flawlessly.
Yeah, it's an amazing department to work for, and I think Tim had mentioned this earlier, but the leadership from the top down is just, it's incredible, and it's such a large department, so, typically it's a statistics game, with more people there can be more likelihood for issues, and when I started, I was truly blown away by just the overall professionalism, how welcoming they were, and just how dedicated everyone is to serving the community, which is amazing.
And I guess my last question would be, the benefit, I guess, to the two of you is probably seeing a position you walk into at a certain level and then realizing that by the end you brought it down considerably.
Very rewarding when that happens.
Yeah, it's one of the, you get to see the change and then the difference in real time, and like one of the...
And then realizing you made a difference.
Yes, yeah, and I think like one of the best things to boost your own mood is to help regulate someone else's mood, so.
Very good. I think that's well said. That's probably a good note to end on. Yeah. I want to thank you both for joining me for
Thank
this
you,
show,
Mark.
and maybe welcome you back at
Yeah, of course.
a different point.
Absolutely.
Thanks for having us,
Certainly.
Mark.
You've got an
We
open
appreciate it.
invite. You're welcome. And thank you at home for watching, and just please remember to support your local access TV station, that being QATV here in the city of Quincy. Take care.